Hello friends, today our medical discussion episode number 28. Today we will discuss on snake bite. So my first question is to you that what are the different type of poisonous snake that are available and how their poison can be effect in our human body?
So, snake bite, it is a very important topic to discuss because there are lot of misconception about what to be done when a person is bitten by a poisonous snake. Almost around 2 lakh population, 2 lakh people are bitten every year by poisonous snakes, and out of this, around 40 to 50,000 die because of lack of the proper care, lack of first aid, and lack of the timely this one attendance in the hospital. So it's very important that a person should know what to be done when a person is bitten by a snake as first aid, and when a person should visit the doctor. So in India, normally there are 4 most common type of snakes that are available. Of this, the most important are the crates. In the crate, there are some parallel stripes that can be seen. Number 2, the most common type of snake is the cobra. So there can be cobra or king cobra. The another type of snake that is present is the vipers. It can be Russell vipers or pit vipers. The snake that can be see that you can see in my background is the viper snake. Actually, how we can know that it is viper? Actually, there is a organ in the back of their tail. It's a type of a musical instrument. They use to vibrate it and produce a sound. The thing that you can see here, this is the that viper snake with that organ at the back of their tail. So the presence of this type of organ in a snake indicates that this is a viper snake. It can be either Russell's viper or a pit viper. The 4th most common variety are the sea snakes. Actually, sea snakes, these are available mostly in the seas or in the water bodies. They live mainly in the water bodies. So these are the most common type of poisonous snakes which beat most of the people and die because of their poisons. Normally, there are 3 type of poisons which are seen in these poisonous snakes. One type of poison which is commonly seen in the sea snake is the musculotoxic poison. It is called musculotoxic because this poison, it affects the muscles of the body or it harms the muscles of the body. When the sea snakes bite, there is destruction of the local muscles. As a result, there is excessive release of myoglobin. It's a type of protein which is released from the muscles. The amount of myoglobin in the blood, it increases rapidly, as a result of which with the local destruction of the muscle, this myoglobin, it goes through the kidney, it affects the kidney, and ultimately the person lands up in kidney failure. The second most common type of poison is the neurological type of poison, that is it affects the nervous system of the body. The poison of the crate and the cobra, these are mainly poison which affects the nervous system, as a result of which there are a lot of neurological symptoms that can be seen in the person. The person becomes unable to breathe. The person, he can't swallow, he can't protrude his tongue, he even can't he became unable to speak a sentence, or he becomes unable to even speak a single word. There is ptosis, that is drooping of his eyelid. The person ultimately lands up in this one, respiratory failure. The person, there can be faintness, there can be confusion, and ultimately the person lands up in coma. The third type of poison that affects the human being is the vasculotoxic or coagulopathic poison. This type of poison, it affects the vessels, blood vessels of the body, as well as it affects the various cells of the blood. So the blood, it becomes unable to clot, that is the blood, there is continuous bleeding from a site, mainly from the tongue, mainly from the gums. There can be bleeding in the urine, there can be bleeding in the conjunctiva or in the inside the eyes. The person becomes unable to see, and it sometimes the person lands up in bleeding inside the lungs. As a result, there can be pulmonary edema and the person may die of respiratory failure. So these are the three most common type of poisons, that is musculotoxic, vasculotoxic and neurotoxic poisons, which are commonly found in these snakes, mostly this type of four types of poisonous snakes. And these poisons kills a person by affecting their muscles, nervous system, as well as their vessels of the body, and ultimately person dies because of respiratory or kidney failure.
Thank you, sir, for this pathophysiology or mechanism of the poison. So now my next question is to you that what are the signs and symptoms that can be seen in case of snake bite?
So when a person is bitten by a poisonous snake, the most important sign is the local symptoms, that is the signs or the symptoms which can be seen in the area of the bite. There are usually two bite marks, that is the marks of the flanks of the poisonous snake, and around that area there can be swelling, there can be redness, or at times there can be severe pain that can be experienced by the patient. As the poison starts spreading, according to the type of the poison, the person can experience different type of symptoms. Among them, if the person is affected neurologically, he becomes unable to breathe, he finds it difficult to take a breath, he can't protrude his tongue, he can't speak sentences, there will be drooping of the eyelids. And if the person is affected by a poison that affects the blood vessels, then there can be bleeding from different sides of the body, mainly from the gums, there can be bleeding in the urine, there can be bleeding from the nose or in the eyes, and the person also lands up in respiratory failure. Moreover, if the person is affected by a musculopathic poison, then the person can have local swelling, local blister formation, there can be gangrene formation in the limb, and ultimately the limb becomes senseless, and the person there may need to be done an amputation of the limb also. Moreover, there can be kidney failure seen in the person which is affected by these poisons. There can be decrease in the urine output, as well as there can be a complete or total renal failure. So these are the different symptoms and signs that are commonly seen in a person who is bitten by a poisonous snake.
So my next question is to you that in case of in a snake bite, what are the things to be done and what are the things we should avoid in case of snake bite, sir?
So this is a very good question, because many people die because of the lack of knowing of the things that to be done or that not to be done. Among the things that to be done are, the person should be taken immediately to the medical facility as soon as possible. When a person is bitten by a snake, the area around the snake should be any jewelry or any cloth around that area should be immediately removed, because ultimately there can be local swelling of the area, and ultimately the edema can develop. The person who is bitten by the snake should remain calm, because many people even die because of that fear of dying. So the person should remain calm, the people around him should talk in a positive way to that person who is bitten by that snake. Moreover, the people around the person should take note of the time when he was bitten, because this is very important, which should be conveyed to the medical doctor. Then the persons who is bitten by the snakes, there should be minimal movement as possible, because with movement there is increased risk of further spreading of the poison. He should be taken to the medical facility by a stretcher or an ambulance. If a person, if this snake who has bitten that person, if this snake has been killed, then the person around him that snake should not go near it, because even a dead snake, because of its reflexes, could bite, because the nervous system is not immediately dead in a snake. So even a dead snake could bite. So if the people around should not go near the dead snake. If possible, a photo of the snake should be taken to convey to the medical doctor. No bandage should be applied around the bitten area. However, there is a special type of bandage which is called Australian pressure immobilization bandage that can be applied, but it should not be used when a person is bitten by a cobra or a coral snake. The people around them should give motivation to the person so that his fear goes down. Now, the things which should not be done to the person who is bitten by a snake is that a tourniquet should not be applied, because most of the people, what they do when a person is bitten by a snake, they apply a tourniquet this proximal to that side. So when a tourniquet is applied, there is reduced blood flow to that area, there will be increased poison spreading in the limb, and their limb could may need to be amputated. There is no need of cleaning or washing the bitten part. There no ice should be applied to the bitten area. There should not be cut applied to that bitten area, because many people we see that they cut the area so let the blood flow. This will increase the spread of the poison. No medication, no painkiller should be taken. The area which is bitten should not be lifted up. And the most important is that many people, what they do, they suck the area to suck up the poison. It's not it's very dangerous. This should not be done, because it will help to further spread the poison and kill the person. So these are the do's and don'ts, not to be done things that every people should know about snake bite.
Thank you, sir. Now, my last question is to you: that what are the things, what are the treatment that can be given to save a person's life in case of snake bite?
So when a person is brought to the hospital, we immediately assess the person, assess the various type of symptoms. We assess the local area, if there is local swelling, edema, redness, pain, etc. If there is no such things, because most of the people are bitten by non-poisonous snakes, or there can be superficial bite by a poisonous snake. In that case, we do a 20 minutes whole blood clotting time, where we take blood from the person, keep it in a test tube for 20 minutes. We see if there is coagulation or clotting of the blood or not. If it clots within 20 minutes, we think that the person may have been bitten by a non-poisonous snake. Then we keep the person for observation for at least 24 hours. However, if the patient has local symptoms or other neurological or vascular toxic poison signs and symptoms, as we have already mentioned, then the most important medicine to be given is the anti-snake venom. Anti-snake venom is it is a type of medicine which is made from the venom itself, which contains the antibodies against the poison of this mainly 4 type of poisonous snakes. So anti-snake venom should be given to that type of person as soon as possible, if possible within 1 hour of snake bite. So if anti-snake venom is given, most of the person are saved. So other things we do symptomatically, like if a person has local symptoms, we give antibiotics so that infection doesn't spread. If a person cannot breathe, we connect them to the mechanical ventilator, we ventilate that type of patient, and side by side the symptomatic treatment goes on. So these are the mainly these treatment that are available for a snake bite. However, the most important thing is the anti-snake venom. This is freely available in all the major hospitals. So the most important thing that to be done when a person is bitten by a snake is that a person should not fear. He should remain calm. He should the less movement should be done as much as possible, and he should be taken to immediately to the local hospital.
Thank you, sir, for sharing most of the so many new things for information to our audience. Thank you, sir. So, lastly, what you would like to request or advise to the audience?
Snake bite, it's a very important topic, but a neglected problem in most of the parts of India, because many people don't know about the first aid methods that to be taken when a person is bitten by a snake. So I think we have discussed very nicely about the first aid methods. What are the signs and symptoms, what are the different type of snakes, what are the different type of poisons, and what are the treatment available. I hope this video will be very useful to everyone. I hope everybody will like this video, share it among their friends, among their near and dear ones, and subscribe our channel. Please subscribe our channel so that we get motivated to make further this type of videos. Thank you so much.